Hello friends, today's topic is self-regulated learning system for medical PG aspirants. I am Dr. Don Jose. I am going to take the class for you. So, what is the relevance of a self-regulated learning system? When a medical student is entering a medical college, he is a part of a system in which he is being taught theory, practicals, lab, clinical. Lot of system is in place so that they have to learn at least the basics of the medical science and become a basic doctor. During internship also they are part of a system. They acquire clinical and practical knowledge of the different specialties. That is not the case when they are going to be a medical PG entrance aspirant. That is an entirely different field. This doesn't have a particular methodology. Some may go for an entrance coaching center, some may go for an online center, some just sit up and learn. Different methodologies are used by or each persons with varying amount of success. So, what is the core of learning in a period in which there is no system? That is the core which you have to continue throughout your life for professional excellence. So, self regulated learning is the key to study during this age. So, what are the parts of self regulated learning? This is a model which is being discussed here. It is more of an idealistic nature. Still, that can give you insights to your learning system now so that you can modify it accordingly and move forward. So, the first part of a self regulated learning system is planning. Second part, which is a vital part, however plan you did, or however assessment you did, however adjustment you did, if you do not learn, everything else is waste. So, what is assessment? Assessment is assessing yourself compared to the self before the learning. So, learning is a process in which there is behavioral change in attitude, change in knowledge, and its application level. Leave that. Coming to adjustment, if you did well, good planning, and you worked hard, you assessed good, and if you don't adjust the planning according to the assessment and learning pattern, you are doomed to fail. So all of these four methods parts are interdependent, important, and useful for you in your studies. So, what is plan? So, to self-regulate effectively, learners must set personal goals. Personal goals are influenced by, or the goal choices and commitment is influenced by personal factors and social and environmental factors. what are the personal factors? One is previous performance. If you have performed in a competitive exam, similar one will give you added advantage of an experience. Then next is skill level. The assumption of skills will define the goal. Nobody usually keep a very high goal beyond their skill level. Then value, which is importance of value in achieving a specific goal. If the person is not believing in yourself and believing in the specific goal, he's going to keep a low goal rate. Then attributing failure to unstable causes such as low effort can lead to higher goals that we'll discuss. Self-efficacy, that is the most important key factor. That is a positive correlation between personal belief that a goal is achievable and strong commitment that will lead to self-efficacy. Environmental factors includes peer group, that is very important. That is normative environment. When you're going for an entrance coaching center and one of your professors is asking you a question and common, and people are answering like anything, and you have no clue about it, then you will understand where you're standing. That normative environment will push you further. Then another model is role modeling. You are finding another role model so that you can emulate them and work hard. And the key factor is feedback. If you are not staying in a person or a place where you are not getting adequate feedback, positive and negative feedback, you tend to stay. That is one thing you have to discuss. So you have to set a goal. Goal has to be for long term, then short term, like for one month you are going to learn this much, and weekly, and you have to make a written goals for each day also. This has to be kept in mind. That is, you are having 22 subjects at least, which you have learned for the span of 4.5 years to 5.5 years. Now you are going to revise it in maybe 1 year, less than 1 year. So you have to give adequate time for revision every week, and maybe last 1 or 2 months, probably 1.5 months, you have to keep entirely for revising. You have notes, videos, textbooks, lot of materials for you. You have to fix which all material you have to learn, which are material videos you have to see during this stipulated time, and divide it to the months, then to the weeks, and to the first 5 days maybe. Then keep 2 days as buffer, and also for revision every week. So this is the part which I want to tell in planning. Now coming to motivation. Motivation, as you know, is intrinsic and extrinsic. Intrinsic motivation is when you are having a enjoyable subject to learn. You are enjoying what you are learning. That is a situation in which it is intrinsically motivable. The extrinsic motivation is divided into different types, like external regulation, introjection, in which individuals seems feel external control but perform to maintain self-esteem. Identification, in which an individual personal importance and of an action and internalize it as a means of broader personal goal. These are all seen, but the best one is integration, in which individuals internalize the reason for action and assimilate them totally into themselves. So, if you are motivated enough to integrate what you have learned, then you may not need an external regulation, somebody to stand behind you and pick your ear. So, this is the different levels of planning. So, what will you do now? Keep some time for planning today itself. Like how many pages you have to cover in the stipulated time, how many hours of video you have to see, how many questions you have to answer. Make a table of it and make it divide into each subjects, preferably topics, but it may not be possible because sometimes you may need more time to learn in medicine than when compared to community medicine, or vice versa. That is your personal attachment to all each subjects. So you have to divide your time. Maybe you got 6 months from now, so maybe 5 months for studies and 1 month for revision. In this 5 months you have to complete, that is before December you have to complete all the subjects you want to learn, including classes, videos, audios, uh, printed notes, your notes, seniors notes, whatever is available, you have to complete it. So you have to divide it into 5 months. Preferably mix it up. Don't study for medicine for like 1 month and leave it again. So maybe one day you can dedicate to medicine. One day you can dedicate to psychiatry and dermatology or something like that. Keep it interesting and make it a mixture. Otherwise, you will learn something, and if you are going to revise it like 1 month, 1 month, or even 4 months back, you will not remember anything. So uh, make it as a continuous habit of learning. That is second thing. Then divide it into weekly targets and daily targets, and even quarter of a day you have to assess how much you have progressed. Are you progressing enough to complete this into the till you reach the goal? So that has to be a continuous process. It is not that you have planned it like this and you do it. So you have to these four parts will be coming one after other continuously, not for a long maybe for a even for a 1 hour study you may need all these four parts. So another thing you can do is keeping a journal. In the first pages you can put your timetable, daily timetable, weekly timetable along with the classes. Then you can record your daily progress, whether you are going adequately or are you overshooting or undershooting. um, is the revision going on correctly as you planned? Is your assessment in your internal assessment, is it in a positive trend or negative trend? Will you reach your predestined goal if you are going like this? That you can write down. That will help you to reassess what you have learned during this day. It will boost your self-esteem also. So that is the another thing. Journal, a timetable, and keep it realistic. Don't overshoot. Don't overestimate what you can do. Okay. So the next part is learning. This is this is the gruesome part. Planning will be beautiful. Assessment will be maybe hurtful, but still it is easy. Adjustment is also good. The basic thing you have to do is learn. So what is epistemology? Epistemology is an individual's belief about knowledge and knowing. It is increasing in stages. The first stage is dualism. That is, all problems are solved. This is usually seen when you are joining your undergraduate course. You think that the teachers will can teach you everything, or you can learn anything. You can become that. You can become this like that. But on going further deeper into the subject, you will know that answers can be found even by non-experts. There are conflicting answers. Some problems are unsolvable. You are growing out of a black and white world. Then relativism is there are different reasoning methods. All solutions should be supported by reasoning. This level of epistemology is very important. So then you know it is grayscale. For an example, if you know that your textbooks, which you learned during undergraduate version, are shady, and there are a lot of wrong information in it, you tend to neglect that and go for standard textbooks. That is that have to happen in this period. Then commitment to constructed knowledge. That is the fourth stage. That which you are integrating it with your personal experience and reflection. So that is epistemology. So you have to know that it is grayscale. There is no absolute textbook you can follow. Authorities cannot help you every time. You have to find your own way, at least in some time. You have to integrate it with your personal experience. These are the at least third stage, or relativism, or at least constructed knowledge you have to reach during your entrance preparation time. So coming to important part, the learning styles. Learning style, usually all persons learn through different senses: visual, audio, read and write also, or kinesthetic. These are different learning styles. This is not exclusive, but these are the main four learning styles. The learning strategy is the mixture of learning styles. It is different for each individual. I may not learn as you, and it have depends on individual learner leads. Some techniques may be useful. Some style may be useful in an area where the person is having high aptitude. If I am interested in medicine, and even the low output method may be good for me if it is fast enough. Different styles. Then context. You cannot learn biochemistry, Krebs cycles, just like your clinical examination of thyroid. So both are different. One may need be you have to read or see the videos and all. The other one you have to do it. That is kinesthetic study, but that is different. And it depends on the environment also, because for an example, if you take up suturing, maybe during undergraduate time you are seeing a video, maybe reading about it. That may be your way of learning. During your internship, you will learn how to suture with the help of your senior. But even that environment is not seen in the entrance preparation time. You are not being taught by a senior. You have to learn it by other methods. Different notes may be there, different future materials may be there. You have to learn about it through any other thing. Even though kinesthetic is superior in this skill, that may be not be relevant in an environment like this. So it depends on the learning strategies has to be dependent on the personal aptitude, different styles in which you can prefer, context or environment or even day of time. One person's style of learning is entirely different from the others. The best person to identify your own style is yourself. Nobody else can help you with that. You have to assess how much you learn. For an example, if you learn, try to solve 100 questions in a particular topic before reading, you may be able to get maybe to 30 to 40 questions, maybe even up to 50 questions, because you have learned it in undergraduate curriculum. So after that, you are reading the same topic, you may get 10 or 15 questions more. If you are adding a visual element to it, maybe you can get maybe 5 or 10 questions above that. So all elements are important, but according to other factors, including personal or according to the subject and the environment, you have to find out which best suits you. For example, I used to think that I had better visual learning style, but I thought if I see a lecture class or a video, I will not forget it till your exam. But I was fooled in my first exam, because I have seen all these questions, but I don't remember these answers. So the next time which I attempted, so I gave more importance to read and write without neglecting the visual and audio techniques. So that is important. Yeah. Then another thing is, if you are a person who will remember things which are heard frequently, you can record it and hear it frequently if you are suspecting yourself whether you will forget it or something. Or you can make it a cheat paper if you have a visual memory. You can paste it over the wall you are studying in front. So these are the different learning strategies, learning styles, epistemology. These are the different things you have to know about learning. So feedback and assessment. This is the third part. It's a very key part, because internal monitoring and self-assessment has to be continuous. It can be done even hourly. Preferably, at least you have to do it in every day. Weekly assessment should be there. So you have to assess. It is not enough that you have reading all the subjects what you have to read, but you have to assess whether it is being assimilated by you. You have to find your own techniques. You have either you can solve the MCQ questions in the topics which you have read in the last week, or something like that. Then you can assess how much have you grasped, or so how much you are remembering. That is revision and internal monitoring and self-assessment. But it tends to be inaccurate. It is less accurate when compared to external formative feedback. That is your exams in your entrance coaching center, or all India mock tests, or some other platform. A lot of tests are there, and you are getting a feedback from the testing authority. That will be more concise, up to the mark, but that is not readily available. So you have to internally monitor and self-assess so that you can identify which is the place you are lacking the knowledge or the formation. So one method is 1 minute per chapter. You have to, in every hour, you are just going back in some part. You are just right and try to write it down or solve a question or something like that. That will help you to focus clearly. Even after you do all these three things, if you don't adjust, if you don't fine tune your plans, you are doomed to fail. So how to fine tune it? You have to reflect on what you're doing. So reflection is in two ways, that is reflection in action and reflection on action. Reflection in action is reflecting over what you are studying while you are studying. So it is just like a continuous process. uh, you are learning something and you are assessing in the back of mind that are you learning, are you maybe are you captaining your Indian cricket team, have you gone out of your way. That kind of self reflection should be there in continuously along with the learning. So the planning should be continuous, learning should be continuous, assessment should be continuous, the reflection should be continuous. The reflection in action is that. Reflection on action is you are particularly assigned, you have particularly assigned time to reflect on the studies you have done. You have assessed, you have planned well for 1 week, you have learned well. In your assessment, you got the data, whether which are the parts you have learned, which are the parts you have forgot. Uh, you have to sit and reflect. Understand? Okay. That is reflection on action. Now coming to the attribution. There are different types of attribution. That is internal attribution. That is the factors in that is internal. Something like your effort, um, your skills. Then is external factors like environment, teachers, luck. Then stable uh, things like which are you are going to do again and again. The unstable things which you are if you believe the outcome you're doing the same thing but the outcome will be different. But the third thing would be the cause, whether it is controllable or uncontrollable. Learners will be most successful at achieving learning goals and outcomes when they attribute poor academic performance to internal unstable factors over which they have control. It should be internal, it should be unstable. That is, that if we believe the outcome might be different, and it is controllable. Example is effort. It is an internal thing, it's an unstable thing. That is, your effort, take effort more, the result may change. The controllable, you have control over your effort. But key assumption is that the learners will want to attribute the academic success or failure in which they maintain a positive self-esteem. That is, when they do not achieve the intended outcome, they tend to attribute the failure to poor teaching or bad luck, the factors over which they have no control. The ideal attribution for academic success is ability plus effort. And in practical terms, effort can be defined as devoting effective learning time and strategies to academic tasks. So, if you are going to attribute the this factor, the reason for your failure on external things, stable things, and uncontrollable things, your plan will not change. You are thinking that you have making full effort. Or in other words, if you are thinking about it's an internal, unstable, and uncontrollable, like your ability. If you are attributing that you don't have the ability to learn all these things, then it is your attribution is to an uncontrollable thing that will not lead to further betterment. So you have to attribute it well. So in conclusion, the timetable is important. Journal, if it is you are doing it, that will help you a lot, because it will help you to assess well, reflect well, and find the attributing factors, and that will help to plan, modify it, and move forward. Journal, another advantage of journal is you can discuss it with your mentor. If you have a mentor whom you can approach, he can help you by seeing the journal. If it is what you call honest. If it is not honest, nobody can help you. So this is the gist of what what I told in this session. Why I took like this is, if I share my experience, that won't help everyone. Like in first attempt, I was like reading for going for a visual learning style, visual oriented learning style. That is, I have read much, but it was not up to the mark. In the second attempt, I have gone for less of videos or lectures and all, and have concentrated more on reading and writing, also audio. Visual was restricted to the facts which I tend to forget, maybe different types of rickettsial diseases, maybe that maps and CD and in the combinations. These sort of things I tend to forget very fast. So I made a table, diagrams, and pasted it all over the wall. That helped me a lot during revision and also during the exams. So if you have any doubts about this, we will be happy to sort it out for you. You can send us a comment or a personal message thanking you. You can ask any questions.